Our top story tonight, hospitals across Montana are struggling with a surge of patients due to COVID-19, and St. Peter's Health in Helena is no exception. MTN's Jonathan Ambarian talked to hospital leaders about how they're handling the situation and what it means for those working on the front lines.
St. Peter's Health leaders say in recent weeks they've moved into a surge plan that they'd prepared for but hoped they'd never have to use. At times, they haven't had any available beds for incoming patients.
It's hour by hour, not even day by day or shift by shift. It is literally hour by hour.
As of Friday, St. Peter's was caring for 11 COVID-19 patients. Chief Medical Officer Dr. Shelley Harkins says even non-COVID patient numbers are higher due to the pandemic, as nursing homes are not accepting new admissions. In addition, they have generally had about 30 to 50 employees who aren't able to come to work because they or their families are in quarantine.
Effectively, all of our service lines are very thin and very stretched.
Amy Brown is a registered nurse who works on the hospital's medical floor. She says it's been a stressful time, especially as they try to make sure they have enough staff to help critically ill patients.
There's kind of a guilt with it too, because you know that if you don't pick up or come in extra, that the people that you work close with are struggling with staff shortages and those sorts of things. So
she urged everyone in the Helena area to take COVID-19 seriously and do what they can to relieve the burden on the healthcare system.
We all need to work together as a community to slow the spread as much as possible so that not just for you, but for your friends, family, neighbors, people that you care about are able to get the care that they need, even if it's not related to COVID.
This week, St. Peter's began canceling some planned elective surgeries because they don't have beds available for the patients afterwards. Harkins said if the situation doesn't improve, they will essentially be rationing care.
Regardless of whether you have COVID or know anyone with COVID or care about COVID, this will still affect your care and the care of your loved ones if we don't get a handle on this and start to see some improvement.
In Helena, Jonathan Ambarian, MTN News.
St. Peter's officials say they are making changes to the behavioral health unit, which will give them an additional 24 beds if they have another surge in patients.